Today we'll touch on a topic that could change your life: diabetes. You may be experiencing the symptoms of this condition without even realizing it. Diabetes can be managed with early diagnosis, but often it goes unnoticed at first. So are you overlooking the hidden signs of diabetes? Keep watching our video as we will now share the 10 key symptoms of diabetes, and at the end we'll give you 6 critical tips to protect yourself from this disease. Diabetes is a problem related to how the body produces or responds to insulin. Insulin is a hormone that helps transport sugar glucose into the cells. People with diabetes have issues producing or using insulin, which leads to high blood sugar levels. Prolonged high blood sugar can cause serious health issues such as heart disease, kidney failure, vision loss, and nerve damage. Now let's move on to the early signs of diabetes. If you experience any of these symptoms, it might be a good idea to consult a healthcare professional. Before we dive into the symptoms, please support me by liking the video and subscribing to the channel. 10 early symptoms of diabetes. Excessive thirst. One of the most common symptoms of diabetes is excessive thirst. When blood sugar levels rise, the kidneys work overtime to remove the excess sugar from the body. This process produces more urine, which causes the body to lose fluid and become dehydrated. In response to dehydration, the body tries to compensate by making you feel thirsty, leading to increased water intake. If you've been feeling excessively thirsty for a while, this could be a sign of diabetes and should be taken seriously. Frequent urination. Frequent urination is quite common in people with diabetes. When blood sugar levels are high, the kidneys work hard to get rid of the extra sugar, which increases urine production. This process leads to further fluid loss, intensifying the feeling of thirst. Frequent urination is a sign that the body is trying to balance out the lost fluids, making it one of the most noticeable signs of diabetes. Hunger. Intense hunger is another symptom that can be more frequent in people with diabetes. When there isn't enough insulin production or when insulin's effect is weak, cells can't get energy, causing a constant feeling of hunger. Even if blood sugar is high, the cells can't use it properly, leading to the urge to eat more. If you feel constantly hungry, this could be a sign of diabetes, and it's important to consult a healthcare expert. Fatigue. Excessive fatigue is another common symptom in people with diabetes. Even though blood sugar may be high, the cells can't produce enough energy from it because insulin is either absent or ineffective. This causes feelings of exhaustion and weakness. When diabetes progresses uncontrolled, it can manifest as chronic fatigue. If you're feeling tired all the time, this might be an early sign of diabetes, so it's a good idea to see a doctor. Blurred vision. Diabetes can affect the eyes, often as a result of high blood sugar levels. Prolonged high blood sugar can cause the eye lens to swell, disrupting the fluid balance in the eyes, leading to blurred vision. Vision problems can worsen over time, and if left untreated can lead to more serious eye issues. Vision loss may become more noticeable in the later stages of diabetes, so it's important not to ignore the symptom. Itchy skin. Diabetes can cause dryness and itching of the skin. High blood sugar levels disrupt the body's fluid balance, which can cause skin to dry out and become irritated. Itchy spots may appear, especially on areas like the legs, arms, or hands. Changes in the skin could signal that the body is struggling to balance blood sugar, so it's important to recognize these early signs and manage them. Bad breath. Some people with diabetes have bad breath, particularly with an acetone smell. When there's insufficient insulin, the body starts using fats for energy instead of sugar. This process produces byproducts called ketones, which cause an acetone-like odor in the breath. This smell is a sign that sugar is not being processed properly, indicating that diabetes might have reached a more advanced stage, so it shouldn't be overlooked. Irritability and restlessness. Another sign of diabetes is mood swings. When blood sugar levels rise or drop, these fluctuations can affect the chemical balance in the brain. High blood sugar can cause irritability, stress, and depression, while low blood sugar can lead to sudden irritability, restlessness, and excessive anxiety. If you notice sudden changes in your mood, this might be due to diabetes, so it's a good idea to consult with a professional. Slow healing wounds and infections. People with diabetes may experience slower wound healing and are more prone to infections. High blood sugar weakens the immune system, making it harder for the body to fight off wounds and infections. Even small cuts or injuries can take a long time to heal and may get infected. These signs could indicate the effects diabetes is having on the body, and should be treated accordingly. Blood sugar fluctuations. Blood sugar levels can fluctuate significantly in people with diabetes. They may be too high or too low at different times, leading to serious health issues. When blood sugar rises suddenly, a person may experience dizziness, extreme fatigue, shaking, or sudden hunger. Mood swings can also accompany these fluctuations. Paying attention to these blood sugar changes is important, as they may indicate that diabetes is not well managed. If you're experiencing any of the symptoms mentioned above, don't worry. There are important steps you can take to prevent diabetes and live a healthy life. Here are 6 key tips for diabetes prevention. 6 important tips to prevent diabetes. Healthy and balanced diet. One of the most effective ways to prevent diabetes is by eating a healthy and balanced diet. This means consuming all the necessary nutrients, including vegetables, fruits, whole grains, and protein-rich foods, which help maintain balanced blood sugar levels. Avoiding sugary and processed foods ensures your body functions optimally. These types of foods can cause sudden blood sugar spikes and increase the risk of diabetes, so it's best to opt for natural and nutritious foods. Regular exercise. Physical activity plays an important role in preventing and managing diabetes. Exercise for at least 150 minutes per week helps balance blood sugar and control weight. Activities like walking, swimming, and cycling support heart health and improve overall well-being. Exercise enhances insulin sensitivity, helping better manage blood sugar levels. Regular physical activity can significantly reduce the risk of developing diabetes. Limit smoking and alcohol. Smoking and excessive alcohol consumption are risk factors for diabetes. Smoking reduces the body's sensitivity to insulin, which can lead to higher blood sugar levels. Additionally, alcohol consumption can cause blood sugar levels to fluctuate, making diabetes harder to control. Therefore, avoiding smoking and limiting alcohol intake helps reduce the risk of diabetes. Both smoking and alcohol can negatively affect overall health, causing other health problems, so it's best to avoid these habits. Regular health checkups. Regular health checkups are crucial for the early detection and management of diabetes (IES). High blood sugar levels can negatively affect many body functions and contribute to the progression of diabetes. That's why seeing your doctor at least once a year for a checkup and blood sugar testing is important. Early detection can help prevent the disease from advancing and make treatment easier. Regular health checkups help monitor your overall health and prevent potential diabetes complications. Get enough sleep. Getting enough sleep helps the body recover physically and mentally. Lack of sleep can increase insulin resistance and raise blood sugar levels. Sleep allows the body to manage stress and helps hormones function properly. Getting 7 to 8 hours of sleep each night is a cornerstone of a healthy lifestyle. Proper sleep helps keep diabetes under control and improves overall health. Increase fiber intake. Fiber foods help prevent diabetes and balance blood sugar levels. Whole grains, legumes, vegetables, and fruits help regulate digestion and prevent blood sugar spikes. Fiber slows down the absorption of sugar, enhancing insulin's effectiveness and reducing the risk of diabetes. Including these fiber foods in your daily diet should be part of a healthy eating plan. Increasing fiber intake is an important step in diabetes prevention. We've explored the symptoms and prevention methods for diabetes. If you notice any of these symptoms, I recommend consulting a healthcare professional without delay. Remember, preventing diabetes is possible, and the steps you take for a healthy life are always valuable. If you liked our video, don't forget to leave a comment and subscribe to our channel. Wishing you healthy days ahead.